Despite assurances from the Gauteng Health Department that measures are in place to address the crisis at Tembisa Hospital in Ekurhuleni, nurses on the ground paint a starkly different picture. It's one of overcrowded wards, worsening hygiene and severe burnout due to staff shortages. The hospital has been without a permanent CEO for over 2 years. Newzroom Afrika's Veronica Makhoali has that story.
Tembisa Hospital is in crisis mode. The hospital is battling with overcrowded wards, staff burnout and a critical shortage of nurses, and it's struggling to provide services to patients.
Well, it's actually very dire because now you've got patients lying in casualty, for instance, for a number of days, and you've got a mixture now of psychiatric patients together with medical patients, and the nurses and other staff categories are not able to cope with the influx of patients due to the shortage. And currently, I think from January, we've had almost 50 staff members that have resigned or left the hospital. And those nurses have not been replaced as yet. So you can, where there was a shortage, there's even a much more dire shortage. And when patients come in, they expect to be served. This on itself, it then impacts on the confidence of the community in getting healthcare services from the hospital. And we're not just talking about Tembisa. Tembisa is just an example of what is happening throughout the province.
The situation is rapidly deteriorating. Out of the 4,900 staff members needed, only 2,300 positions are currently filled.
You cannot, especially in casualty, you cannot be expected to take care of 135 patients, and yet you only have about 10 nurses on duty. And I'm talking now to different categories, because every category has got a duty, even according to Nursing Council, on what you can do and what you cannot do. So workforce is very limited. So you can't reach to everyone all the time. It's very difficult. In that situation, we need about 50 to 60 nurses on duty if you're going to nurse 135 patients a day.
With only an acting CEO and nursing director at the helm, the leadership vacuum has worsened the situation, not just for staff, but also for patients.
They can expect not to find a bed for their families because the wards are full. And they can also not expect to be treated the way they would expect to. We need to give them the best care we can, but we are limited in resources, human resource and equipment as well. Theatre, we have theatre in Tembisa that is so heating up, doctors are collapsing there during the operations.
Tembisa Hospital has been in hot water before. In January 2021, the Health Ombudsman's report on 35-year-old Shonisane Lethole's death exposed severe negligence and systematic failures.
We've always been warning our executives to say, you guys are taking us back to the Shonisane issue on a daily basis. And we as nurses, especially the nurses, we're pushing. We're trying by all means to push to say we don't want our nurses to go back to that situation.
The Gauteng Health Department says interventions are underway.
We have heeded the input of organized labor on how to tackle some of the concerns raised. This will form part of the ongoing program to improve the level of services in our facilities. We've already started implementing interventions to address these issues.
Unions are calling for urgent intervention, warning that frustrated nurses may soon take their grievances to the streets. For Newzroom Afrika on Channel 405, I'm Veronica Makhoali in Tembisa in Ekurhuleni.